Hello, everyone. Welcome. I'm Dr. Danielle O'Connor. I'm a naturopathic doctor. I've been in practice for 20 years now, and I see a lot of women with menopause and perimenopause. And today I'm here and I'm going to be speaking with Dr. Sophia Chachula, and very excited about this talk. So hopefully, we've got a lot of questions for her. She's going to give us some great information. So today, Dr. Sophia will be talking about how you can best prepare your body for conception and simple things that you can do to really optimize your fertility. So Dr. Sophia will touch on why getting proper testing is important and which testing you should be talking to your doctor about, what foods can be used to optimize fertility, and which foods are best to limit or reduce, and which key supplements and nutrients are important for preparing your body for conception. So I'd like to welcome Dr. Sophia. I also have Dr. Vidya here, and she is also a naturopathic doctor and does some work in the fertility space. So she will also be asking some questions later on, but welcome to you both. Sophia, if you want, please introduce yourself and tell us a little bit about your practice.
Absolutely. Hi, everybody. I'm very excited to be here talking about, optimizing fertility and how we can best prepare our body for conception and on International Women's Day. So happy International Women's Day to everybody that's celebrating. So my name, as said, was Dr. Sophia Chachula. I'm a naturopathic doctor that's based in Mississauga, specifically Port Credit. I currently work at Pure Balance Wellness. And my practice, I like to say, is, women's health and hormones from puberty to postmenopausal, but a specific focus on, the fertility care, pregnancy care, and postpartum care. I have a big passion for helping women throughout all stages of their hormonal journey.
Wonderful, wonderful. Well, welcome. And I'm going to get started right away. First question, really right off the bat. So, a lot of women want to know really what is that first step that you would recommend that women start really thinking about when they're thinking of, conceiving in the near future, maybe what that timeline is. But yeah, what's that first step that they should be taking?
Absolutely. So preparing your body for conception can really mean a lot of things, and it can be anywhere from a year to a few months before. And that very first step I always recommend, whether it be for fertility or even just self-care, is to get a thorough, proper assessment done, look internally and get proper, thorough blood work done. And why that is an important first step is to see if there are any nutritional deficiencies, metabolic disorders, hormonal imbalances, or any other disorders that might come up that could cause as a barrier to conception. And in this case, knowledge really is power, because the more you know about yourself and your body, the more you can give it tools to succeed. And I'll go through a few of the tests that I think are most important to be included, to ask your naturopathic doctor or physician whether this is right for you. But let's start with, CBC, complete blood count, ferritin, which is a measure of your iron stores, vitamin B12, and vitamin D. And in this group, we're really looking at, are there any nutritional deficiencies that might cause a barrier to conception? Of course, we've had a long winter, it's still going. And vitamin D is one of those things that I always recommend to get tested, because most often than not, especially, in North America, a lot of the times maybe women can be very deficient, and that could cause quite a significant barrier. The next step is getting a full thyroid panel done. And by that, I mean TSH, which is your thyroid stimulating hormone. This is the one that people maybe refer to the most. T3, T4 is the hormone that your thyroids produce in response to TSH, as well as the two thyroid antibodies, thyroid peroxidase antibody and antithyroglobulin. And why these specific antibodies are important to test is to see if there are any underlying autoimmune thyroid conditions that could serve as a barrier to conception, but have not yet affected or aren't affecting the TSH, T3, T4 levels, and could often just go kind of missed or under the radar. And thyroid, being your master gland, plays a huge role in its regulation in sex hormones, which is the next, on our list for thorough, proper blood testing. You have your estrogen, your progesterone, and your testosterone. Estrogen is best to either, get tested around day 3 of your cycle. And by day 3, we mean the third day of bleeding, day 1 being the first day of your menstrual cycle, and day 21. Day 3 kind of gives you a baseline level of where your estrogen is at that moment. And then day 21 is in its relation to progesterone. So progesterone is important to test on day 21 specifically to see, it can give us an insight into whether or not you've ovulated and whether or not in that luteal phase, which is the phase that comes after you ovulate, your body is producing proper estrogen to support itself. Estrogen is important not only for preparing for conception, for conceiving, but also for carrying to term. And the next one, we have testosterone, which can be really tested on any day. But testosterone itself can be elevated in certain hormonal imbalances, like PCOS. We often see, could be elevated androgens. Androgens like testosterone can cause symptoms like excess hair growth on the face, acne, as well as hair loss. And that can also cause a big barrier to conception if left untreated. Similarly, another androgen is DHEAS, which I often recommend, we include in our blood work. DHEAS is actually an androgen, and by the word androgen, we mean a hormone that causes more male-dominant traits, like those symptoms that I talked about. And that also is seen in women, higher in PCOS and other hormonal imbalances, and can also cause this barrier to conception that we might want to look at as well. Next, we have LH-FSH. So LH-FSH are 2 levels of, egg health, ovarian health, and your egg reserve. LH being, luteinizing hormone, FSH is called follicle stimulating hormone. You want to get this tested early, day 3, the beginning of your cycle as well. And this, when you're testing, you want to see a ratio of roughly 1:1. So if you have LH at a level of 5, you're looking for FSH to be roughly 5. In certain conditions, we can see LH being 2, sometimes 3 times higher than FSH. And that can clue us into, again, something like PCOS, which is a condition I commonly see, if you can tell. And in the reverse, if we see FSH being 2-3 times higher than LH, then here we're seeing the potential for something like premature ovarian aging or premature ovarian failure, which is also a barrier to conception that requires a different treatment plan that you might want to know beforehand. Next on the list, we have fasting insulin and fasting glucose. These combined together can give us an insight into, metabolic disorders, insulin resistance, which is often seen with hormonal imbalances. And lastly, AMH. So AMH is your anti-Müllerian hormone. It is tested a lot in fertility clinics, but often kind of left out of the preconception, getting to know your body testing. I think it's important for most of all women to consider, talking to their doctors, naturopathic doctors, about whether or not that's right for them, but especially if they have a family history of early menopause or premature ovarian failure. And again, everything is, always supposed to be tailored to you. So if you have a family history of, say, autoimmune disorders, or if you have a family history of inflammatory conditions, then something like inflammatory markers like CRP or ANA might be really beneficial to include in this preconception testing.
Wonderful. Wow, that's a lot of great information and a lot of tests that, people definitely need to be thinking about. Now, just a couple follow-up questions with that. When do you usually suggest that people get all these tests done? Should it be 6 months before they're thinking about conception? Should it be a year before? And are all of these tests normally done by people's medical doctors, or do they have to kind of wait to be at a fertility clinic to get these tests done? Obviously, you as a naturopath can run all of these tests, but are you seeing them from other medical professionals?
Absolutely. And those are great questions. So first and foremost, I think the earlier you can get something like that done, the better. So of course, if you're able to start thinking about fertility and conception a year out, that would be, maybe the most beneficial, because you have a lot of time to correct and work on anything that might come up. If something like PCOS comes up or signs of endometriosis, then that can take a long time to, assist your body in supporting it to get it ready for conception. Obviously, if you're kind of lessening the window, 6 months would be better than 3 months, and so on. So the earlier you can get it done, the better. I do find that, again, like, no naturopathic doctor practices the same and no medical doctor practices the same. So sometimes people really are able to get these full and robust, pre-fertility, preconception blood works done from their family physicians. But oftentimes the most left out are usually the thyroid antibodies, for sure. That's something that I see, whether it be a personal choice in practice, but that's something that I often see not being tested, and something that I really recommend because, like I said, a lot of the times, kind of those autoimmune thyroid conditions that maybe run in your family that aren't yet affecting those TSH, T3, T4 levels, but are producing even significant symptoms that you're coming to see me for, can really be important to know as soon as we possibly can. AMH is something that's also not really commonly tested until you get to a fertility clinic. Of course, if we're able to, I think the earlier the better from anything, as well as there's sometimes differences in how we test our blood sugar. So fasting insulin and fasting glucose, from my perspective, is more important when I'm looking to test like insulin resistance, seeing if there's a barrier there. But I think the more preferred choice I see tested is like HbA1c, which is also can be very insightful, but doesn't do the exact same thing.
Absolutely. Great. That's wonderful information. Okay. So next I'm going to ask you a question more in terms of diet and different foods. So are there any, foods or really like ways of eating that are best for women when they're looking at conceiving?
Absolutely. So I think food is usually just the foundation of any healthcare plan, any hormonal balancing plan, fertility workup. And I think it's amazing that we can use food to be able to boost and, increase our chances of conception. So I'll talk about a few ways and a few kind of habits and ways of eating that are important, and spotlighting a few certain foods. So, of course, making sure you have adequate protein and adequate healthy fats. A lot of people are actually surprised when I tell them that I don't think they're getting enough, adequate protein in their diet. And I'm not talking about an excess of protein that we sometimes see. It's just adequate protein. For example, breakfast, like something like oatmeal, usually something really nutritious, nutrient dense, and can be a great part of your diet, but lacks a little bit of that protein that we need. So upping it with things like nut butters, nuts, seeds, chia seeds, an egg on the side, if that allows in your hormonal profile disorder. Of course, always talk to your naturopathic doctor and family physician, but making sure we get adequate protein is important because protein provides us with the amino acid building blocks that your body needs to take and make those hormones like estrogen, like insulin, like thyroid hormones, and so on. It also helps stabilize and balance your blood sugar. So in a lot of hormonal conditions, especially in women, hormonal imbalances and blood sugar imbalances, insulin resistance, metabolic disorders go hand in hand. So keeping your blood sugar stable can really help keep your hormones stable as well. Making sure we get adequate healthy fats is another important key piece. So of course, 20 or odd some years ago, it was all about the low fat diets. And some people are still really holding on to that today. And what we've seen in research is low fat diets can actually decrease progesterone and estrogen, which is the two most important hormones that women need for conception and fertility. And healthy fats include things like fatty fish, nuts, seeds, avocados, olive oil. The next part of eating isn't going to be surprising. It's just making sure your plate is as full with as many vegetables with as many different colors as possible. And I want to highlight two specific, categories. One being the dark leafy greens. That includes kale, Swiss chard, collard greens, spinach. So those are rich in magnesium, zinc, vitamins A, vitamins K, and folic acid. And folic acid is that nutrient that our body needs to store up and prepare for conception, to carry to term, for fetal development and health. And so that's a really important thing to add to your diet, or to see if you're able to add to your diet. And cruciferous vegetables. So those include broccoli, Brussels sprouts, cauliflower, kale again, which is showing up to be the superfood. And cruciferous vegetables can help rid or help your body process any excess estrogen. So in certain conditions like endometriosis, we may see slightly higher levels of estrogen. And those symptoms can be things like mood swings, things like heavy periods, and increased weight gain. Next up, and we've already talked about a lot of anti-inflammatory foods, but eating in a way that's anti-inflammatory. So protein, healthy fats, vegetables, but I want to spotlight antioxidant rich berries. And antioxidant rich berries might be important to add because antioxidants themselves can really have been shown to help with improving ovulation, timing of ovulation, preserving your egg health, and preserving that ovarian health. A few more foods I want to spotlight are avocados. So avocados are really rich in monounsaturated, fatty acids. We talked about why healthy fats in general are important. They have a lot of fiber to them, but at the same time, avocados have also been shown to stabilize and regulate our stress hormone cortisol. Cortisol is often something that's can be affected or imbalanced by hormonal imbalances as well, or stressful lifestyles, and can be a barrier to conception. They also help regulate that estrogen progesterone balance. Next up is beans and legumes. So beans and legumes are a really great source of fiber and protein, but have also been researched in their role for helping the timing and quality of ovulation. And lastly, pumpkin seeds. So pumpkin seeds are my favorite powerhouse little superfood. They have lots of omega-3 fatty acids. They have, lots of zinc, lots of magnesium. And so what that helps is, yes, it helps with hormonal balance, that estrogen progesterone ratio, but it's actually been, studied and researched in its role in increasing blood flow to the reproductive organs like your uterus, which you need for proper implantation. And those foods are really the highlight of what you want to consider adding in when you're thinking of conception and fertility. I'll also add, more so a style of eating, is making sure that you're getting, breakfast, lunch, and dinner in, like not skipping meals. Oftentimes people can skip lunch. I think it's really common now, and this can be a topic for a whole other time, but to skip breakfast and just making sure we have like really nutrient rich protein at breakfast, lots of, really good healthy fats, veggies, and protein at lunch and dinner is also really conducive to like helping balance that blood sugar. Foods to reduce are not going to be surprising. We're looking at your really highly processed foods. So foods that come, foods that are really altered, genetically modified, come in packages. Also a diet that's really full of refined carbohydrates. And it's not refined carbohydrates from time to time. It's a diet that's full of, white breads, white pastas, white potatoes, white rice, and lacking of anything else, as well as high sugar diets. So refined carbohydrates convert to glucose in the end. High sugar diets, of course, are a quick, natural, immediate source of glucose. And in certain hormonal imbalances that may have increased testosterone, like PCOS, high sugar diets can actually drive testosterone further upwards. So that's something to be mindful of as well.
Amazing. That's great information. And yeah, you definitely went through all of those different food groups. So I think that's going to give people a great idea of where they really should be focusing. And I know you spoke about like some of the nutrients in there with obviously that you're going to be getting from the foods that you're eating, but are there some specific supplements or, nutrients that are important really at this time when people are thinking about conception?
Absolutely. So, the foundations, we've talked about the testing and looking inside. We've talked about the food and supplements. I always say can help like move the needle, help provide your body with the nutrients that it needs, especially when preparing for conception. The first one, of course, is going to be a prenatal vitamin, but not all prenatal vitamins are created equally. And what I like to look for in a prenatal vitamin is one that has the active form of folic acid, which is 5-tetrahydrofolate, often seen on the label as 5-MTHF. That improves slightly in its bioavailability and how your body uses it and produces it, as well as I like to look for folic acid or prenatal vitamin that doesn't have too many additives or fillers, or dyes, just things that you don't need that are maybe causing more harm than good, as well as a prenatal vitamin that has the non-constipating form of iron, because oftentimes that can be a barrier for women taking their prenatal vitamin if it's making them feel worse. And things like iron bisglycinate, iron glycinate, that's a more non-constipating and gentle form of iron that you might want to look at. The next supplement is omega-3 fatty acids, omega-3 fish oil. So fish oils in and of themselves, really anti-inflammatory. They're used for a wide variety of conditions, especially hormonal imbalances. So not only do they help, reduce inflammation, they help balance hormones, they help balance that estrogen progesterone ratio, which is important. They've been shown to lower testosterone, improve blood sugar balance, and improve blood flow to, your organs like your ovaries and your uterus, which is important to consider for conception as well. Closer to, DHA is a type of fatty acid that's important for fetal development, which is something to consider when choosing. And coenzyme Q10 is another one I just want to spotlight. That in and of itself is an antioxidant. Some people may have heard of it for heart health, but what it does, it's an antioxidant that increases your energy reserve in the body, and it actually has been studied and shown to improve ovulation, improve the quality of eggs ovulated, preserve egg health. Similarly to melatonin, it does that. If anybody's taking melatonin, it's also improving your egg health. And again, just like with food, just like with testing, everything needs to be individualized. So if in your first, step, you've gotten your whole blood work done and you've discovered something like PCOS, so your supplement that you might want to talk to a naturopathic doctor about or a physician is something like inositol that improves egg health, that improves, quality of ovulation, that lowers testosterone, and it might be different than somebody who doesn't have PCOS, who maybe won't need to go on that supplement. Similarly, if endometriosis comes up or something inflammatory, you're looking to really look for your preconception plan to have more anti-inflammatories. And that's something that's individualized and that's discovered through the planning, through the treatments, and through work with a naturopathic doctor.
Amazing. Yeah, there's definitely a lot of things to consider. Obviously, when you're talking about testing, you're talking about, foods and diet. You're also talking about specific nutrients and supplements that you need to take into account. And that's, that you really need to think of ahead of time, right? So it's definitely important to pair up with a good naturopath like Dr. Sophia here. So so that you can really have that individualized approach that every person should have, because all of our bodies are different. We're all experiencing different things and different symptoms and different diagnoses. So that approach needs to be specific to that individual. So thank you so much for all of this wonderful information. Like I said, I do have Dr. Badaya here too. I don't know if she has any questions that she'd like to add in here. I'll pass the mic over.
I have one question. I know there are several people who work with fertility clinics, so I'm wondering if it is possible to work with a ND as they're seeing a doctor at a fertility clinic.
Oh, absolutely. So I always recommend, if you're going to see a naturopathic doctor and seeing going to a fertility clinic at the same time, always let your fertility clinic know that you're seeing a naturopathic doctor and what they're doing, to make sure there's no interactions and to make sure everything we're doing is on the same page and conducive to your plan. But absolutely, naturopathic doctors who might focus their research and patients on in the fertility area know how to best serve to prevent any interactions, to help prepare your body for fertility, to help around IVF success as well. A lot of the times we do have patients who are going through IVF who are looking to improve their chances, to prepare their body, to see if there's any supplements, nutritional, guidelines they might need to follow to help boost their chances and increase their chances of success. We also have acupuncture as an amazing tool that we use to regulate hormones, period, and can also help with, IVF support or any fertility clinic support as well.
That's wonderful.
Amazing. Okay, well, thank you so much. Thank you, just from Health Buddha, thank you so much for being here and giving all of this information. It's so useful, this information. And I think it will really help people that are really starting out that journey of conception, right? So thank you so much for being here, and hopefully we'll have you out for another webinar, and we can talk a little bit more. Perhaps maybe, I know you mentioned a lot about PCOS or fertility, different things. So that would be great. Thank you so much.
Thank you so much for having me. Thank you. I love talking about this topic and would love to be here in the near future. So thank you very much.
Wonderful. Okay, have a great day. Take care, everyone.